there has been, this is the second go around, right? When American Journal of Managed Care, right? The first go around was not sustained. And I think we have to all ask ourselves, is this more of the same? Or is there a reason why this time is different? And I believe this time is different. But it's not just going to happen, we have to make it happen. And this time is different for a couple of reasons. One is the data and analytics tools that we had now that we could only dream of before that can actually help us get better care at lower cost. It's not a less is less situation, less can be more, but you need really much more sophisticated analytics than people had 20 years ago to be able to put in that service. And I think the policies are a little bit smarter, but I do think there are 3 risks to sustainability for ACOs. And this has absolutely nothing to do with Medicare regulations, right? The first is the risk that patients will feel like they're getting less in order to make profits for the providers. So we cannot ever stint on care. There are plenty of ways to get better value by doing things better, giving the patient more access, better care, not less needed care, right? The second risk is that providers who are part of these systems, that there's no transparency for them. At the end of the day, they don't know, they didn't get any money and they don't know why they didn't get any money. And I worry a lot about that, both on the part of health plans, lack of transparency in data and their code, but also in terms of ACO organizations not being transparent with the practices in terms of what the costs are and how the returns are going to get divided up. So governance and transparency on the provider side. And the third biggest risk, of course, is that the payers say, you know what, we're not really seeing results from this. Let's go back to just, squeezing down on the rates. And we need to be able to deliver results in terms of lower total cost of care for a population that's getting better health and better quality. And I see too many folks just kind of rolling the dice or having monthly meetings, but not really fundamentally getting in and changing how healthcare is delivered.